So this is a question that actually harkens back to what we were talking about with respect to parenchymal versus leptomeningeal metastasis. Someone in the audience has astutely observed that they're seeing more patients being diagnosed with progression from lung cancer and manifesting as leptomeningeal disease. And why do we think that is? And do we have our treatment responses I guess, the way leptomeningeal disease responds to our current therapies, is it improved compared to historical therapies? And I will toss it out to anyone. I saw a
Happy
lot
to
of head
jump
nods.
in just quickly. I know we're running short on time. I do think we are seeing a little more of it, partly because our drugs are getting more effective, right? So we have good ways to control all the rest of the disease. I think the better we get at that, the more likely eventually to see that the meningeal disease to be the thing that comes out that causes us trouble. And because it's harder to treat, it's a little more resistant. So I do feel like we may see more of that. And it speaks to how critical clinical trials are and development of therapies are targeting this form of disease. So I think we're going to have to solve it if we want to get people longer term control in many situations. I do think even with that, our current therapies are getting better at treating it. So I think we're making progress and we have ever more options to try to control it. We just run low on those options a little faster than we do for other forms of disease. I think there's progress, but I agree it's difficult and a lot more progress is needed.